I heard you want to give birth without tearing down there. Well, you're in luck. My name's Christine. I'm a pelvic floor physical therapist, and I help women during pregnancy and postpartum. Today, we're going to go over the exercises you should be doing and how to perform a perineal massage. I want you to do this video every day, 6 to 8 weeks before your due date, and you'll be ready to give birth without any tearing in no time. Let's go ahead and get started with the exercise portion. So we're just going to start by deep belly breathing. I want you to take a big breath in and exhale through your mouth. As we're breathing, I want you to imagine that you're breathing through your butthole. I know that sounds silly, but if you can really visualize your breath going all the way down to your pelvis and opening up those pelvic floor muscles, you can even think of your two sit bones expanding away from each other and opening up like a flower. Usually when I tell people to breathe through their butthole, they're like, what? And then they do it and they're like, oh, okay, I get it now. So that's what I want you to be visualizing. If not, then just take deep breaths in and out through your nose. This is a great way to relax our muscles and get us prepped for the next few movements. Great, we're gonna go ahead and turn over and do some cat-cow. So for cat-cow, I want your knees where they are, but I want you to bring your feet apart and then do the cat-cow. What this does is it lengthens the pelvic floor muscles. And as you're doing this, really focus on your breath. Good. You can bring your feet back to neutral, and we're going to do some thoracic rotation where with your left hand, reach across your body, looking at that hand the whole time, and then come up and reach towards the ceiling. Start with the left, and then I'll tell you when to switch halfway through. Make sure you're breathing the whole time, in through the nose, out through the mouth. Go ahead and switch sides. Good. Okay. Now we're going to do an inner thigh stretch. So you'll leave one knee on the floor, straighten the other leg. So we can start with the left. From here, you're going to sit back towards that right leg. You should feel the inner thigh stretching. We're just going to hold this and breathe, trying to take those deep breaths and sinking deeper into the stretch as long as it's comfortable. Good. Okay, let's walk ourselves over and do the other leg. Right leg straightens. and we sit back. Remember to keep breathing. Good. Okay. For our final stretch, we're just going to be in a deep squat. So feet come wide apart. And I want you to sit down into a deep, deep squat. If you need to use a chair or something for support, please do so. You can also sit on a small yoga block or stool and just have your knees further apart and breathe into this, really focusing on relaxing completely and breathing. I like to keep my elbows inside my knees to push my knees out for a deeper stretch. Good. Okay, go ahead and come out of that. I'm going to grab the model of my pelvis and show you exactly how to perform the perineal massage. So after you've done your exercises, you're really relaxed, you've worked on your breath work, we're going to start with the perineal massage. You want to be doing this 6 to 8 weeks before your due date, and you want to use a water-based lubricant. You can do it yourself or have a partner help you. So you start at the vaginal opening. You can either use your 2 thumbs or a wand like this one. This is called the Perineal. I'm not sponsored by them at all. I bought this with my own money, but I really like this because of the groove it has. And I've had a lot of patients use this and really like it as well. So this is an option. I'll show you how to use this as well. So you'd start here. If 2 thumbs go in to the vaginal opening, about this much. So think of like going into your first knuckle. Then you're gonna pull down. You'll feel pressure at the perineal area. The perineal area is the area between your vaginal opening and your butthole. And you're just gonna press down and hold it. It's gonna feel uncomfortable. So it'll feel like as if you're pulling your 2 lips apart and like you get that tingly, weird sensation. It's gonna feel like that here. Hold it as long as you can. So the goal is to get to 60 to 90 seconds and you're breathing the whole time. Of course, if it's too painful, ease up on the pressure. Then once you've done that, you're gonna go up into a U and then back down. And you'll do that for another couple minutes. So you insert your thumbs, you pull down, you just hold that for about a minute, minute and a half. Then as you're breathing, you'll come up into a U and back down. If there are any points that you feel are really tight and need more of a stretch, you can absolutely hold there for a little bit longer. If not, you can just be doing that U massage. If you're gonna use a wand, it's the same thing. You insert it. So I would insert it in the vaginal opening up to about right here, and I pull down. I just hold that and I breathe the whole time. So 60 to 90 seconds of a hold. And then I go up into a U in one direction, back down, up to the other direction. And I'm just doing this smooth sweeping motion. We can hold at any points that feel they need an extra stretch, or we can keep going for about 2 to 3 more minutes. In total, this would take you 3 to 5 minutes to do the massage, and you should be doing it daily. If you have any questions, let me know. You can do it yourself, you can have a partner do it. If you're doing it yourself, make sure you're in a position that's relaxed and you're able to reach without straining too hard. So prop yourself up with as many pillows as needed, use lots of lubricant, and good luck. If you have any questions, let me know. Take care, and I will see you next time. Bye.